In Philadelphia, Pennsylvania. That's right. I went to UB. What seems like an eternity ago. I graduated in 2008, and I really enjoyed it there. I really did. I had a great experience. I came from Long Island, big university, it's everything I wanted. A football team, had all the majors in the world, and I was kind of naive to it all, living away from home. But coming here really, gave me perspective on what I wanted to do in my life, and yeah, so now after a few years of kind of trying to figure it out, I came to Drexel. And I just thought, I'm going to tell you a little bit about my experience in grad school and the process, a little bit about Drexel and public health as well. Just a quick show of hands, is anyone health major or thinking about health sciences? A couple people, a few people, most others not. Anyone else? What is everyone else studying? What are you studying? Computer science. What do you study? Engineering? Alright, so this might not pertain to you exactly, but I'll do my best to kind of skip over some of the health stuff and cater more towards the graduate school experience. So you can kind of up there. So, like I said, Huntington, Long Island. I came here. It took me a couple years to figure out what I wanted to do. I was business. I took business calc, and that was it, business. So now I've decided to go into something I was more passionate about, which was history. Some of the things I did here, I did some volunteer work. I was with Schussmeisters. I wrote for Visions Magazine for the Student Association. I don't think Visions Magazine is a magazine anymore. Does anyone, you guys get that? All right, so that might have been just for a short period of time. I worked for the football team. So while I was here, I was kind of building my resume. I was doing a lot of things undergrads are supposed to do, is just kind of build it up and expand on your experience here. So it took me a couple years, but I started doing some of those things. And then I just want to fast forward a little bit. I left University of Buffalo and I moved to Boston, Massachusetts. And I'm going to go start my career. I'm going to go do this thing. And I kind of wasn't sold on history. What was I going to do with a history degree? So I took a few years away and I did some work in Boston doing social work, and it was kind of unrelated. And after some time, I developed a more passion for doing public health. And what public health is, it's an effort that addresses physical, mental, environmental health concerns in communities and populations, focuses on prevention of injury and disease populations rather than centering on a single individual. So how that related to me was I was working with people with disabilities. It's on an individual level, and I saw some issues that I had problems with, and I thought, how can I get this on a broader scale, policy change and things like that. So that's how I decided to kind of shift that away. So it took a gradual stepping stones to kind of come to where I came to, but this is pretty much what public health is. So with public health, it's a really interesting degree. There's a lot of different avenues you can get to. I think you can jump to the next slide. I'm going to have some things. There's a few different things. You can do community health and prevention. You can go to the next couple of slides. Epidemiology, biostatistics, that's the study and analysis of disease, research of disease. Environmental, occupational health, childhood lead poisoning prevention, things like this. The next slide is management policy. That's what I study right now. So that's working at a hospital administration, as a project manager at insurance companies and things like that. So the school at Drexel, we're a school of public health. There are programs in public health. So you need to, and this goes for engineering, this goes for business. You really need to research what universities you're looking at. Are they small programs within a school? Are they a school itself? Are they accredited? Things like this really do make a difference at the end of the day. It's going to shape whether or not you get research opportunities. It's going to shape whether or not you get career opportunities. So by just doing a little bit of research and background into the schools and programs is really a big thing. So and they have doctoral programs too. So I don't know if anyone's trying to become a PhD. Or at that level, that's something you can consider as well. Some of the benefits of accreditation. This is specific for public health here. Promotes societal health and safety through rigorous education, meets acceptable standards by the profession, increases career options, as I said, and determines eligibility for federal funding. These are a few things about Drexel. I won't get too much into the history of it, but Drexel's been around for a really long time. They're a great university. I hadn't heard about it until about a year before I applied. It was a school that I really didn't know much about, but having been there, there is a rich history there. There are a few different campuses. Philadelphia, if you guys haven't been to Philadelphia, I would suggest visiting. It's a great city. I flew here this morning. It was 45 minutes. It was really quick. It's probably about an 8-hour drive. So choose your method of transportation-wise. There are a few different campuses. Center City campus is right next to City Hall, Love Park. Great neighborhood, a lot of restaurants, shops. Benjamin Franklin Parkway has all these beautiful art museums. It's a really great neighborhood. University campus is across the Schuylkill River, which divides the city, and University of Pennsylvania is there, as well as Drexel's campus. As well, we have Green Lane, which is the medical campus, and we also have a satellite campus in Sacramento, California. The mission of Drexel School of Public Health is to promote the health of communities through an integrated program of education, research, service, and practice. Pretty straightforward mission statement. It's mostly written down. This is our leadership. This is Dr. Rich. This is our intern dean, although we just hired a new dean for our school. He's also a professor in our Department of Health Management Policy, and so we have a pretty esteemed faculty list. There's 44 faculty across the 4 departments. As previously mentioned, that was community health, management policy, epidemiology, and environmental health. So we have a lot of research centers. So as being an accredited school, as I said, whether it's health, whether it's engineering or business or computer science, you really want to look into what your school offers. Drexel, as an accredited school, has really a lot of research centers, which means they get a lot of federal funding from tons of agencies. Federal funding means that our professors can really go into the research they are interested in doing, and they are more than happy to hire on students as RAs, research assistants. And by research assistant, that really builds the resume, so it's something really to consider. We have institutes in autism, biostatistics, and you see a few others right there. I had the chance to work with the Autism Institute when it first started. It was a great early experience for me, and it's really going to help me in my career moving forward. You could continue to the next slide. With Drexel, we have a number of different degrees, from NPHs to joint degrees, MD, MPHs. We can talk about that further if you have any questions. And also, we have global health certificates. So I'm not sure if anyone knows, but as an undergrad, you have to study broad opportunities all the time. Grad school really isn't any different, especially in public health. You can study abroad. We had students this past year go to Dominican Republic, to South Africa, to Gambia, which is also in Africa, and they did 2-week to 4-week projects out there, which is pretty cool. And we also have courses in that as well. And we also just introduced an LGBTQ certificate program as well. So yeah, some of the sites that people have been to all around the country: Canada, Africa, to South Korea, and Europe. This is our full-time MPH program. It's a 2-year program, 64 credit hours, and a specialty, as previously mentioned. So just a brief overview of our school really quickly. 2-year program. We have 3 classes in each of the first 3 quarters there. And in the spring quarter, you'll see something as practicum. That's just a fancy word for a 10-week internship. We're on the quarter system, so it's 10-week quarters. And that last spring, we'll do a 10-week internship at a site of your choosing, from clinics to hospitals and so forth. And year 2 also, you're taking 7 classes. So for the most part, you're take 2 classes on 2 quarters and 3 classes 1 other quarter. And you'll also be doing a community-based master's project, which is a year-long internship, again, at your site of your choosing. It culminates in an oral defense, big thesis project, and it's actually pretty great because they give you the full year to work on the project. You often team up with other people, you work in group work, and it's really helpful to kind of have that experience in grad school, which is, for me, which is kind of the reason I went to Drexel, and part of the reason I went to grad school was kind of get that experience that I wasn't getting in Boston, in the real world, and also as an undergraduate, I didn't have that experience also. So yeah, the community-based learning was a really big thing for me. The 120 hours, that's over 10 weeks, like 12 hours a week. I had a chance to work at an eye hospital. It was a really great experience, and it's something that you're responsible for each week to clock in and clock out. You have reports due with class. You're responsible to have a poster presentation at the end of the year. And the master's project again is that year 2 experience. So yeah, by the time you graduate, you have about 600 hours of experience. Yeah, so that's kind of just the defense at the end, things like that. What we're talking about. So yeah, so with when you're working in public health, you really have a variety of places you can work with. You can work with the department, in the government, Department of Public Health, through the city government. You can work at children's hospitals. You can work at nonprofits. Right now, I work at a behavioral health nonprofit, law projects. So there's really anything you can imagine through Drexel has really been available to you. And again, these are just some of the things that people have worked on over the years there. Assessing food access and strawberry management, which is the neighborhood of Philadelphia, coordination of medical and dental care, operations, the medical examiner, and a few other titles there. So it really varies. So it's pretty interesting. Student life, yeah, there's a number of students. This year, the incoming class is about 150 strong, a little bit more than that. For the student body, there's a lot to do as a graduate student. There's just as many opportunities in grad school as there is in undergrad. We're part of the student government, just working with the deans on, getting some volunteer days in, getting some socials, happy hours going for the students to kind of collaborate a little bit more, doing some departmental work within the university as well. Intramural sports too. There's a whole range of that. We also have free fitness center memberships in the city. We have a brand new rec center on campus too. And, students are definitely taking advantage of being in Philadelphia, where Reading Terminal Market, if you guys have never been to Philadelphia, the place to go to. It's just a great open market, a lot of food vendors. It's relatively inexpensive, so it's a hub for people when they get to Philadelphia to get to that, as well as some of the art museums as well. So I kind of wanted to get through that a little bit quicker to get to kind of why I chose Drexel and why I chose grad school. So, like I said, when I was an undergrad student, I kind of had a I had a hard time, figuring out what I wanted to do in my career. And by choosing a history degree, I took some sociology classes. For me, it was something I was passionate and interested in, but at the same time, I knew I wasn't sold on that as a career. So when I took a few years off, I really wanted to evaluate why I should go back to school. And one of the biggest things for me was, what I was doing was really satisfying in a way that I was helping individuals with disabilities, but I really wanted to do it on a greater scale. So when I looked at universities, I wanted to look at something that, professors that weren't so removed from the real world themselves. So when I saw that the professors had worked in the field at the Center for Disease Control, worked in hospitals, worked in all these different settings, people with autism, that's something that sold me immediately. These were people who were still working in the community on a day-to-day basis, and to work with them, to learn from them was something that I was, that was like a requirement for me when I looked at school. So I encourage you, when you're looking at your schools, to really get a good look at the faculty. What are they interested in? What are they doing? Is it research? Maybe it's research. Maybe it's not. One of my professors has a column in the Philadelphia Inquirer. He's a great writer. He's a very funny guy. And, that was just a really interesting take. He kind of made class a little bit different just by virtue of having that experience in his life. And the practical experience. We have required internships. For me, again, being in the field, away from the classroom was a really big sell for me. So maybe some schools for you are, curriculum-based, really class-heavy, textbook-heavy. And if that's what you're interested in, that's something you should really pursue and really narrow that down. For me, I was, an internship, I want to get out there, I want to help the community, I want to have real-world experience while I'm getting my degree, so I can leave here with not only a master's degree, but also hit the ground running right into a job. In many cases, these internships lead directly to full-time jobs after you graduate. So that was a huge thing. And of course, it's really where you want to live in the country. Some people are from the East Coast. I'm from Long Island, lived in Boston, went to Buffalo. So living in Philly was kind of a part of living in the Mid-Atlantic, the East Coast region, and that was really important to me. And also, I love sports, I love food, and I kind of like the small neighborhood feel. So for me, Philadelphia was just a great fit as a university. I applied to schools in Washington, D.C., and Pittsburgh, also that kind of met some of that criteria. And so, it worked out that I went to Drexel. The application. So Erin did a fantastic job describing the process, which I hope you guys took some notes on. If you didn't, you can feel free to speak to me or her after about a little bit more about that process. It's for public health it was easy. There's a website portal. You're able to just upload pretty much all the documents onto one portal and just send it out to every school. It was it cost money, but it was relatively easy. The coursework at Drexel, it's been really interesting. You get the required courses to learn a little bit about which concentration you want to get into. And then by your second year, which I chose policy and management, I found more I'm going to find more intimate discussion-based classes there. 15 students per class, as many as 25 per class. And also with public health and in graduate school, you're going to find that it's a lot more group work, partner work. You really rely on each other to get things done. So it's really important that you find somebody you work well with. It's not your best friend, but maybe someone who has strong writing skills if you don't have strong writing skills, or strong speaking skills if you don't, and try to balance that out. So that's a really important balance when you start working with a partner or a group at grad school, because you're held accountable individually, but as a group also. So you really want to find that balance where you're growing on your skills, but you're also improving some of those weaknesses. The practical experience, kind of drilled home. It's just great. Drexel has a lot of opportunity, especially in healthcare. And student life again, extramural, student government, a lot of things. Student government sent me here actually. I applied for a travel stipend. I was lucky enough to get airfare. So when you work for your student government, even your student association here at Buffalo, there's a lot of perks to that you might not realize. So getting involved from the start has improved my relations with the deans, has improved my relationships with my university here at Buffalo. So it's something that I'm really grateful for. And First Fridays gives you free access to some museums in Center City. So student life-wise, SIPS, Center City SIPS is like a happy hour Wednesday thing going on, and concerts also, a ton of concerts. So Philadelphia's got a lot going on there. This is the website. You can find all schools' public health programs. Give you a little bit more detail. Give you some website, phone numbers, contact, and things like that. And the next slide, I think, this is our contact information. Colleen is our Director of Enrollment, phone number, address, and things like that, email address too. So I'd be happy to leave my email address for anyone who wants to directly contact me or stay in touch with any student body at Drexel, or I can get in touch with people at other programs at Drexel, and even at UPenn as well in Temple. So there's some other universities to think about too. So if anyone has any questions, I'll open it up to myself, to Erin here.
In fact, why don't Erin, why don't you come out? Why don't you guys just have a seat there? This is a great opportunity for them to ask some questions to. And Greg, what year are you in there?
So I'm beginning my second year of school.
And then Erin's been in this higher education.
A student affairs administration program here at UB, and I'm in my second year.
Second year.
Right.
So think about some questions. I have a couple questions I want to ask. First of all, what would you say, maybe we start with Erin, what would you say is the biggest